Good morning, everyone. My name is Krishnali, and my topic for today's presentation is reducing foodborne illnesses. First, I would like to start with what are foodborne illnesses. Foodborne illnesses result from consuming food or water contaminated with harmful pathogens like bacteria, viruses, parasites, or chemical substances. Contamination can happen during any stage of food production, including processing, storage, or preparation. To prevent these illnesses, it is important to practice proper hygiene, cooking, and storage methods and to ensure that food safety regulations are being followed at all stages of the food production chain. Next, why is reducing these illnesses important for food and nutrition management? Reducing foodborne illness is important to protect the health of the public and make sure strict food safety standards are practiced, which also ensures that the food we consume is of high quality and nutritious. It also prevents economic losses for food manufacturers and businesses who can experience financial backlogs from spoilage. Reducing these illnesses promotes sustainable food systems by enhancing food safety, minimizing food waste due to contamination or spoilage, and ensuring resources are used efficiently to produce safe and healthy food for everyone. Next, specific legislation or regulations and which sector of the government foodborne illnesses come under. The Canadian Food Inspection Agency, also known as CFIA, is in charge of ensuring the safety of food produced, imported, and sold in Canada, as well as protecting consumers from foodborne illnesses. Various laws and regulations, such as the Food and Drugs Act, Food and Drug Regulations, the Safe Food for Canadians Act, the Safe Food for Canadians Regulations, and the Consumer Packaging and Labeling Act and regulations are in place to accomplish this. These regulations govern food composition, labeling, packaging, additives, contaminants, and pesticides, among other things. The CFIA enforces these regulations through inspections and investigations, as well as collaboration with other government agencies such as Health Canada and Public Health Agency of Canada to monitor and respond to outbreaks of foodborne illnesses. The concept of reducing foodborne illnesses. Foodborne illness reduction needs an integrated strategy that includes a variety of approaches and practices aimed at preventing, controlling, and minimizing the hazards associated with consuming contaminated food. These illness prevention consists of identifying and avoiding possible sources of contamination at each stage of the food supply chain, implementing and executing food safety regulations, as well as training and educating food handlers and consumers on food preparation and handling can all be included in this category. Minimizing illness usually involves responding quickly to outbreaks and minimizing their impact on public health. When an outbreak occurs, it is critical to identify the source of contamination and act quickly to prevent further illness spread. This can include recalling contaminated products, putting in place measures to prevent the spread of illness, and offering medical attention to those who are affected. Some of the symptoms that we should know about foodborne illness are fever, nausea and vomiting, dehydration, upset stomach, cramps, or diarrhea. Who is responsible for reducing foodborne illness? To reduce foodborne illness, relevant parties, including government agencies, food businesses, food handlers, and consumers, must work together. The prevalence of foodborne illness can be significantly reduced by implementing effective strategies and practices to prevent, control, and reduce the hazards associated with consuming contaminated food, resulting in a safer and healthier food supply for everyone. Apart from this, as discussed before, the CFIA is in charge of ensuring the safety of food produced, imported, and sold in Canada, as well as protecting consumers from the illness. The CFIA also enforces regulations through inspections and investigations, as well as collaboration with other government agencies such as Health Canada and Public Health Agency of Canada to monitor and respond to outbreaks of foodborne illness. Significance of foodborne illnesses. First, public health. Foodborne illnesses can have serious consequences for public health, ranging from mild stomach upset to hospitalization and even death. We can protect individuals and communities' health and well-being by reducing foodborne illness. Economic costs. Foodborne illness can have major consequences for the economy, such as healthcare expenses, decreased productivity, and decreased consumer trust in food safety. These costs can have a break effect on businesses, industries, and the economy as whole. Foodborne illness can harm the prestige of food producers, manufacturers, and restaurants, resulting in lower customer trust and loyalty. Businesses can protect their reputation and maintain customer trust by reducing foodborne illness. Food safety regulations are in place to protect the public's health and prevent the spread of foodborne illness. Businesses can adhere to laws and avoid penalties and legal consequences by reducing foodborne illnesses. Some common types of foodborne illnesses to know about. Food poisoning comes from many sources, including bacteria, viruses, and fungi. Listeria, E. coli, Campylobacter, Salmonella, Staphylococcus, Ciguatera, Shigella, and botulism are some to name. When is it important to concentrate on reducing foodborne illness? Whenever a person observes symptoms like nausea and vomiting, diarrhea, abdominal cramps, fever, headache, fatigue, and dehydration. When a foodborne illness outbreak occurs, it is critical to quickly identify the source of contamination and help stop further spread. In these situations, reducing foodborne illnesses can help prevent serious health risks and save lives. Certain populations such as children, the elderly, pregnant women, and those with compromised immune systems are most likely to develop severe complications from these illnesses. It is especially important to protect these vulnerable members of society by reducing foodborne illness. When people travel, they may be exposed to new food and food habits and practices that they are unfamiliar with. It is critical to reduce foodborne illness in order to protect travelers from potential health risks. Where does foodborne illness exist? They exist in various facilities, but to start with, food production facilities. To prevent contamination and reduce the risk of foodborne illness, food production facilities such as farms, processing plants, and packaging facilities must adhere to strict food safety regulations. Restaurants, cafes, and other food service establishments must adhere to proper food handling and preparation procedures in order to reduce the risk of the illness. This includes keeping food at the proper temperatures, cooking it to the proper internal temperature, and serving it on time. How to reduce foodborne illness? To prevent the spread of bacteria, it is critical to wash hands, utensils, and surfaces frequently. Hands should be washed for at least 20 seconds with soap and warm water before handling food, as well as after using the lavatory, changing diapers, or handling pets. Separate. To avoid cross-contamination, raw meats, poultry, seafood, and eggs should be stored and prepared separately from other food. Cook foods to the proper internal temperature to kill any harmful bacteria that may be present. To ensure that the food has reached a safe temperature, use a food thermometer. To slow the growth of harmful bacteria, keep perishable foods refrigerated at 40 degrees Fahrenheit or lower. Food should be thawed in the refrigerator or microwave as well. These are the main 4 steps to food safety, which are clean, separate, cook, and chill. Summary. Foodborne illnesses are illnesses caused by eating or drinking contaminated food or beverages. These illnesses can range from mild stomach upset to hospitalization and in extreme cases death. Foodborne illness symptoms include nausea, vomiting, diarrhea, fever, and abdominal pain. Foodborne illness prevention is important for a variety of reasons. It has the potential to reduce serious health risks and save lives, protect vulnerable populations, maintain customer trust in food safety, and reduce economic costs such as healthcare costs and lost productivity. Individuals should follow proper food handling and preparation practices such as frequently washing hands and surfaces, separating raw meats from other foods, cooking foods to the appropriate internal temperature, and keeping perishable foods refrigerated at 40 degrees Fahrenheit or below to reduce the risk of foodborne illness. To prevent contamination and reduce the risk of foodborne illness, food manufacturing facilities, restaurants, and other food service establishments are required to follow food safety regulations. So we can help ensure that the food we eat is nutritious and secure by following these guidelines. 3 test questions that I think can be asked are: what are some of the most common symptoms of foodborne illnesses? Why is it critical to lower the risk of foodborne illness in vulnerable populations like children and the elderly? What are some methods for preventing the spread of harmful bacteria and lowering the risk of foodborne illness in food manufacturing and service establishments? These are the references for the above content presented in the presentation. Thank you.